Now we look at the scapula from back. The triangular scapula, the medial border, the lateral border, the glenoid cavity. The posterior surface of the scapula is divided by a projection called as the spine of scapula, which has a deltoid tubercle on its inferior border, and this spine of scapula goes and becomes the acromion process. On the acromion process articulates the clavicle, forming the acromioclavicular joint. Now we'll rub off what we'll not be able to see. But we'll rub off what we'll not. We'll rub off from here. Here we'll make the suprascapular notch and we'll put the anterolaterally directed coracoid process. Here we'll make the transverse scapular ligament. Above we'll pass the suprascapular artery. Below we'll pass the suprascapular nerve, and they'll supply the muscles in the supraspinous and the infraspinous region. So before that we'll make the head of the humerus and the greater tuberosity and the shaft of the humerus, and on this we will sit the supraspinatus muscle, which passes below the acromion, here, and gets inserted onto the greater tuberosity. Then the infraspinatus muscle, which gets inserted below this. So we have said S, we have said I, and then we pass the teres minor muscle, which gets inserted here. So these are the muscles that we pass. And we shade them. Now piercing the circumflex around the lateral border, piercing the teres minor, is the circumflex scapular. Then on the anterior side you have the anterior side of the humerus, you have the bicipital groove, and you have the lady between two majors. So this is the groove, and we'll pass the teres major muscle, major on the medial side, pectoralis major on the lateral side, and latissimus dorsi in between. That's the lady between two majors. So here we'll pass the teres major, which will go and get inserted onto the medial side, Then we'll pass the latissimus dorsi, which will be basically winding around the lower border of the teres major and getting inserted onto the intermediate part of that between the two majors, that means between the teres major and the pectoris major, and on this side we'll make the pectoris major. So here is the lady between two majors, pectoris major lateral and teres major medial. Again we'll color it to give you a better view. So we'll make this colored like this. So this is the lady between two majors, the teres major and the pectoris major, latissimus dorsi between two majors. Then we'll place the tendon of the teres triceps. It's originating from the infraglenoid tubercle here. It passes in front of teres minor. So it passes somewhere here. Then behind the teres major and latissimus dorsi. And we'll color it up to here. And then we'll color this brown because it's converted into the muscle. And this ends up in what is called as the radial groove. So here is the radial groove. On the lateral and upper side of the radial groove is the lateral head of the triceps here, and below is the medial head of the triceps. So the long head, the lateral head and the medial head, you form the triceps muscle. The radial nerve, so this is the quadrangular space. Here you have the quadrangular space bounded by the teres major, teres minor, teres major and surgical neck of humerus, out of which emerges the axillary nerve and the posterior circumflex humeral artery. The nerve supplies the teres minor, which has got a pseudoganglion, and it also supplies the deltoid. The deltoid we'll just show by a line. The deltoid is originating from the acromial process, lateral border, getting inserted into the deltoid tuberosity of the humerus, and this nerve supplies the deltoid pierces it and also supplies the skin in an area which is called as the regiment batch area. Out of the lateral triangular space you have the passage of the radial nerve. The radial nerve which winds round the shaft of humerus, piercing the lateral intramuscular septum. So here is the lateral intramuscular septum, and this septum must be pierced by this nerve which is winding round the neck of humerus. So here is the hole through which this nerve is winding round the shaft of humerus and going anterior. So this is the radial nerve, and along with the radial nerve you have the profunda brachii artery, which is also doing the same thing. Then you have an artery, the circumflex scapular artery here. So this is the structure here, and this scapula is basically attached to the spine by a muscle which is called as the levator scapulae, rhomboidus minor and rhomboidus major. So rhomboidus major, rhomboidus minor and levator scapulae. The importance of the levator scapulae is that if it is short congenitally, it will prevent the scapula from descending down, and therefore the shoulder will become higher, and that is called as Pringle shoulder. The other thing is that if the Pringle shoulder is bilateral, it is called as Klippel-Feil syndrome. And if this is ossified or fibrous band or calcified, then it becomes bony and it is called as omovertebral bar. Now this whole structure is basically this superficial to this. You have, we'll make it again. We'll make the scapula again. Here is the clavicle. Here is your humerus. And here is the skull with the mastoid process. And here you have the spine. So we'll make the muscles which are behind the rhomboidus major, levator scapulae, rhomboidus minor, and these muscles are arising from the superior nuchal line, the ligamentum nuchae, and first 12 vertebra, and getting attached to the inferior part of the spine of scapula, medial to the deltoid tuberosity, then along this part, then along this superior border of the spine of scapula, the medial border of the spine of scapula, and posterior border of the clavicle. So this whole muscle is the trapezius. These fibers of the trapezius, these fibers will pull this end downwards, and these fibers will put this end forwards. So along the axis of this deltoid tuberosity, beginning from the deltoid tuberosity and going to the sternoclavicular joint, the scapula will rotate superiorly. This angle will go superior. So that's an external rotation of the scapula. The other muscle which will be pulling this, is attached to the medial border anteriorly, and it will pull the lower angle in this direction. So trapezius and this serratus anterior are the external rotators of scapula, and they are responsible for overhead abduction. On the outer border of the clavicle, anterior border of the clavicle, outer border of the acromion, and right up to the inferior border of the spinous scapula, right up to the deltoid tuberosity, is a muscle which is called as deltoid, and this deltoid goes and gets attached to the outer border of the shaft of humerus. So we'll make this deltoid here. And the third muscle that arises from the lower 6 thoracic vertebra, from the 5 lumbar vertebra, and from the iliac crest, posterior one third of the iliac crest, and goes and gets attached as the lady between two majors, on the bicipital groove. In the bicipital groove, the lady is latissimus dorsi, and the two majors are pectoralis major and teres major. So basically this muscle is covered by the triceps in the upper 6, but then you can see it here. So this is the latissimus dorsi. It winds round the lower border of teres major. You can see the teres major here. It's winding around the lower border of teres major, and teres getting inserted between the teres major and pectoralis major. So this is latissimus dorsi. So between the medial border of scapula here, the trapezius on the medial side, and latissimus dorsi inferiorly, you have this triangle, which is called as the triangle of auscultation. Now one final diagram for you to understand how this is the scapula. You are looking from above. Here you have the head of the humerus, the lesser tuberosity, the bicipital groove, and the greater tuberosity. Here you have the ribs going anteriorly. So you remember that here is the subscapularis going and getting attached to the lesser tuberosity. Here is the pectoralis major coming from anterior side. So here is the pectoralis major. And then from the medial side medial border is the serratus anterior, which goes and gets attached to the rib. This serratus anterior is supplied by the nerve to serratus anterior, which is a branch from the roots 5, 6, 7 roots of the radial plexus. Now this serratus anterior would basically pull the scapula like this. So it will protract the scapula. This is called as protraction. Then you have, we'll also make this which is attaching to the spine. This is the levator scapulae, rhomboidus minor and rhomboidus major group. So these are the muscles here. And these muscles are the supraspinatus, infraspinatus, teres minor group, and behind it you will find the trapezius and the latissimus dorsi group. So this space here, bounded by serratus anterior, pectoralis major and subscapularis, is called as axilla, and it houses the axillary artery, the axillary vein, and the brachial plexus. The median, the ulnar, the musculocutaneous, and the radial nerves. So this is what you have to remember.